Welcome. This is Doug Sesserman. I'm the CEO of American Associates Ben-Gurion University of the Negev, and welcome to this version of our Live from Israel webinar series called Ben-Gurion Briefings. Today, we've put together a panel of experts from Ben-Gurion University to focus on the world pandemic coronavirus. Before starting, I just want to thank the university president, Danny Shamovitz, as well as Jeff Kay for their incredible and positive leadership during this time of need and uncertainty. I also want to thank my professional staff here at AABGU, led by our CMO, Ronnie Strong, and Melody Mokhtarian, who manages all our events and experiences, including the webinar series, and my assistant, Gina Ferdman. We're showing great agility in being able to function while the office is closed. We're functioning completely virtually, although there are a few people here in our New York office. It's noon Eastern time, and with daylight savings, I believe Israel is 6 hours ahead currently. So it is 6 p.m. Israel time, and let's get started. So we have 4 great experts today. I'll be introducing them one at a time. But to begin, I'll just give you a sense for who they are. We have Professor Limor Aharonson-Daniel. She's the Vice President of Global Engagement at BGU. We have Professor Nadav Davidovitch. He's the Director of the School of Public Health. And we have Doctors Tomer, Hertz, and Ron Taub, who are members, along with Nadav and Limor, of the interdisciplinary task force being overseen by BGU President Professor Shamovitz, that we believe is one of Israel's leading efforts, certainly at a university, in a proactive response to the coronavirus. So the title of this webinar was called Pandemic or Unjustified Panic. Let's start with you, Limor, as the Vice President of Global Engagement, but in particular as an expert in emergency preparedness. Tell us about how this has affected BGU, its operations, and what you're doing at the university to keep the students, faculty, staff, and the Negev region healthy.
Okay, hi everyone. Thank you for inviting me to talk about this topic. I think that whenever we would talk about it, it would be a different description of what is going on, because our reality has been changing tremendously and very quickly during the past, I think it's probably 6 weeks now. The Ministry of Health of Israel has been very strict in the measures that it has been taking from the beginning. When the coronavirus first was discussed in China, I think it was the last week of January, many countries stalled until they did their first response, and Israel was quite one of the first countries to actually close the borders with China, close the borders with other countries in Asia, limit the travel of visitors from these countries, and from recommendations to Israeli citizens to travel to Asia at the beginning. And then as we were looking at the trends of the growing numbers in different countries, the limitations expanded to different countries. So the Ministry of Health was actually setting the policy. And BGU only had to oblige with these guidelines at the beginning. We would meet, we formed, the leadership of BGU formed an emergency forum, which we had, originally we had it from other instances of usually it was missiles falling and so on in the past. So we had our drill about how to get together in the morning and discuss what's going on. But this was a much larger scenario than we had ever tackled before. And it also required different tools than the ones that we had used before. And we were actually learning as we moved along. We invited experts, medical physicians and so on, to our forum to explain to us what's anticipated, to understand better the epidemiological trends of what's going to happen, and how we can best protect BGU and what else we can do. In terms of what's going on at BGU, because I'm Vice President for Global Engagement, I'm responsible for all the international students that are on campus, and also for our BGU students that are doing student exchange programs in other places. And in general, the academic community is very much on planes, going to other universities, going to other research institutes. So for universities to suddenly start looking at where people are traveling was a very significant change of the state of mind of the university. So at the beginning, we would just look at the lists of people who are planning to travel and already had a permission to travel or funding, and tell them, okay, you're supposed to be going to China, not a good idea, you're not going, and so on. So that was the beginning. And then
The international students that are on campus, are they still there, or have they been sent home?
we didn't send anyone home. We allowed some students, the students who wanted to were allowed, of course, to go home. One of the greatest things, the positive things about this whole crisis is that BGU transferred to teaching online. Within a very short period, and I think that a huge appreciation to our provost, our rector, Chaim, and to Danny for his leadership, and Ifat, who's taking care of all the technical aspects, that we were able to move from 0 to 100% online teaching. And actually,
My understanding, I think you just confirmed it, is that BGU is now 100% remote online learning. That's correct. No physical
yes.
classroom participation, etc.
No physical classroom. Everything is remote. We tried it for the first time yesterday. Today was a full teaching program. We have very good responses from students and from staff using these systems. So our international students are they're in the dorms or wherever they live. They participate in the online learning, and that's why some of them decided that they want to move back home, because they can continue their semester at BGU, although they're back to their home. We allowed that because of this strange situation, and if somebody
Excellent.
doesn't feel comfortable to be in a distant country, I think they should go back home and be with their families and still maintain their studies at BGU.
Okay, thank you very much. For the audience, just so you know, the way the format will work for this webinar is we're going to have a discussion that I'll facilitate for the next 30 minutes or so. The whole program will last an hour. You can ask questions by clicking on the Q&A button. I'll be able to read those questions, and toward the end of the program, I'll direct the questions to the appropriate panelist. So let's switch to Nadav Davidovitch. Nadav, you're an MD, an MPH, a PhD. You're an expert in public health and direct our school, as I mentioned before. I think you know what you're talking about as it relates to this field. So let's start with the first question, which is the World Health Organization has declared coronavirus a pandemic. Please just define for us, what's a pandemic versus an epidemic, and let's start there.
Right. So first of all, an epidemic is an outbreak, and outbreak is mainly related to unexpected number of cases or severity of cases. When you have an outbreak, it is now in many different countries, in several continents. We have now more than 150 countries that are being involved. So finally, it's a pandemic. By the way, in the beginning, it was announced as a public health of emergency of international concern. And this was the first dramatic kind of announcement of the WHO, was based on the international health regulation that were established announced in 2005 after the SARS outbreak, mainly because there was lots of misunderstanding, miscommunication, different case definition. And if you remember the SARS epidemic, different countries reacting in many different ways. It was very detrimental to the question of trust, etc. I was then in the Ministry of Health, and I was part of the group that was implementing the International Health Regulation since 2007. I think that it's very ironic in a way, or maybe not ironic, maybe timely, that last week I started to teach together with Professor Ran Baliser, that is also very involved. He's a professor at the School of Public Health and also at Clalit Health Services. We started to teach a course in epidemiology of infectious diseases. And one of our modules is on pandemic. So this is very timely. Now, in many ways,
let me just clarify. So a pandemic is an epidemic gone worldwide. Is that fair?
Right, exactly. In many ways, we are now just working according to all of the different protocols, different roundtables, drills. Years ago, we established a field epidemiology course together with the Ministry of Health and the in Israeli Center for Disease Control, the Army Health Branch. Then we established the Middle East Consortium of Infectious Diseases. We had courses with Palestinians, Jordanians, that unfortunately several years ago were stopped because of political reasons. But what I'm saying that in those who were involved in all of these drills are not so surprised. I mean, we are surprised, of course, that it's happening, but we are following all the protocols now.
So let's talk about some of those protocols, and I'll just give you a sense. Our feeling in the States is that Israel was ahead of us in terms of
Yes.
a governmental response. And we titled this webinar, Pandemic or Unjustified Panic. And right now in the streets in New York and other major cities around the world, around the States, and even in smaller communities where restaurants are closing, only open for takeout, there's this concept of flattening the curve by de-densifying and practicing social distancing. Can you comment on those strategies as it relates to containing a pandemic, and in particular kind of Israel's view on that?
Right. So I think that the question of panicking or not panicking really depends on how you're dealing with the situation. So at the beginning, there was the whole question of preventing cases coming to Israel. This was the first stage. Then we moved to the stage where we had already some cases, but mainly those who were either brought like from Japan, from the ship, if you remember. And later people coming back from countries like Italy. But we could trace all of the cases somewhere outside of Israel. And this was a very important, these two stages were extremely important because the idea was that we are going to have cases in Israel as we have now. So people thinking that, this could be stopped, the idea of a pandemic, no, it cannot be stopped. But yes, it's about flattening the curve. But this is a very important concept because if you are going wild, like unfortunately was in Italy, so the whole capacity of hospitals, even in a country like Italy, that by the way, they have one of the best healthcare system in the world. By the way, my sister lives there and she's pregnant right now, but that's another story. So even in a country like Italy, if you lost control, you are overwhelmed. So gaining time in order to prepare on several different fronts, as we are doing now, one, establishing a testing mechanism, not just for people that are sick, but in general to do sampling all around the country in order to understand the real picture. Second, doing triage in order to have those mild cases, because most of the cases are mild cases, especially in young age. So having them out of the hospital, in the community, either at home or in special places being designated, and protecting the healthcare workers and creating the protocol so people are not going to be exposed. Now, this is very important from the epidemiological perspective.
So if I hear you correctly, basically this notion of flattening the curve until we found a vaccine or some solution to this virus, and we'll talk about that a little bit later with Ron and Tomer, the key is to reduce the contagious nature by keeping people isolated.
Right, and in many ways, Doug, this is very old and very classic. So the whole idea of hand washing, you probably are fed up already with all of that. Keeping a distance, reducing social distancing is very important. But what I really want to emphasize here, that you need to do all these epidemiological measures together with keeping with the social issues. So we are teaching in public health that we call it health in all policies. This cannot be just the Ministry of Health. It must be all the ministries, including now the communities, the municipalities, the welfare system, the education system, working on many, many different details, how to keep, for example, the children that are at home, how to deal with the elderly and the municipalities and the welfare system, they know best, how to deal with a resilience program that we have in Israel. Limor knows about it very well. She is very engaged in it. And we have these resilience programs related to other issues that we know, like missiles, etc. Now, if you are presenting to the public a professional picture with the interpretation, not by politicians, but mainly by public health experts, if you have the information transparent, if you have all the decision making, all the consideration that are presented to the public, this is very important. I think in general, I can give a very good mark to the Israeli response. All these people, by the way, many of them that are sitting on all these committees are also faculty member at Ben-Gurion University. Professor Itamar Grotto, the Deputy Director General, is a faculty member. He did his PhD at the School of Public Health, then not the School of Public Health, but one of the departments, because the school was established only recently. Professor Ran Baliser, Professor Kobi Moran Gilad, and many others are either graduate or teaching at Ben-Gurion University. So we are doing quite well. From time to time, we need to press in order to move ahead. I was until recently the chair of the Israeli Public Health Physicians Association. I'm still involved there. And sometimes we need to raise our voice on different issues. I'm, for example, a bit concerned about some of the issues of privacy. You probably heard about it. There were lots of discussion right now. And also today, for those of you who are not aware, the Minister of Health officially announced several hours ago that we are moving into much stricter social distancing and actually quarantine with some exceptions. We are waiting to see how it's going to be exactly presented. So Ben-Gurion University, as Limor said, we are preparing already for several weeks, doing lots of things. Many of us are also on the media, presenting the picture and commenting. So I think that now we are entering into the most challenging phase. We're going to enter now at least to several weeks of imposed quarantine, not complete quarantine, but almost. And we need to remember that the nature of the virus and the epidemiology, that measures that you are taking now are going to influence the situation in 2 weeks. So that's something that is also very challenging.
I don't mean to cut you off while I'm cutting you off, but I just wanted to let everybody know.
So I was finishing my small interpretation. And thank you.
You bet.
Thank
We're
you
going to
for
come
all
back.
the support in general. I mean, that's really great. And for me as a public health physician, this is our time. I wish we won't have it, but now we are, fulfilling all of what we were teaching and preparing for years.
Listen, from the beginning of of the beginning of Israel's modern history, its purpose has to be a light unto the nations. And I think right now you're serving that role in an exemplary way. We thank you for your ability to do that and what you're doing at the university to keep Israel safe and also safeguard the world from what we're facing. Okay, so it's our privilege and a pleasure to be here to support you and make make the people in the States aware of the great work. I just want to switch for a second and let you know that we have over 220 participants from around the country and all over the world, Israel, Canada, participating in this webinar. My Zoom technology is blowing up with questions from the audience, so I want to move this along so we can get to the questions, and now pivot to Ron and Tomer, who are doctors, each of them experts in different areas. I want them to explain their own background. I do have your bios, but it's so technical in a way that I'm not sure I understand, so I want you to be able to translate. We'll start with Tomer, who received his BS in computer science and his PhD in computational neuroscience at the Hebrew University. You're an expert in machine learning and pattern recognition. You have postdoc training in computational immunology, spent some time with Microsoft in the research area, and you have transferable knowledge from the study of host pathogens and the evolution with the HIV vaccine, and you're really considered one of our top infectious disease specialists. I want you to speak for a little bit about the work that you're doing right now as it relates to the coronavirus.
So we are, we are trying to figure out ways to do something, because honestly, the situation is evolving at such a pace that, every thought we have seems to be arriving at the scene a little later than it should have arrived. At this point, I am involved in 2 projects that we are trying to move forward that are just, we just wrote them up in the last, few days. The first is we're very keen on trying to understand why some patients deteriorate much more than others. There has been data suggesting that comorbidities, so, heart conditions, diabetes, and of course age are associated with severity or, mortality. But that doesn't seem to explain, the entire set of cases we're seeing in deaths. So there are people that are being, admitted to ICUs around the world now that are not in the risk groups, that are not old, that don't have any comorbidities, and we don't really understand what separates them from others. There have been multiple theories put forth, and we are now in the process of writing a, Helsinki, so like an IRB protocol for collecting, specimens from patients in the Soroka Medical Center, which is the university of, our university medical center, to basically try to get at questions related to, previous antibody responses to circulating human coronaviruses. So I don't know if you know, or the listeners know, but there are 4, human coronaviruses that are circulating in the world on a seasonal basis and account for about 20 to 25% of, respiratory infections in humans, at least in Israel and in many other places in the world. So normal
Could you
adult,
comment just quickly, because you just mentioned it, the difference between a coronavirus and this COVID-19?
So the COVID-19, or what's actually the SARS-CoV-2 is the name of the virus, is one of now 7 coronaviruses that can infect humans, with 4 being seasonal strains that have been around for a long time, and then the 3 others being the first original SARS from 2003, MERS, which is a camel disease that was originally found or transmitted to humans through camels, and is primarily been around the Arabian Peninsula, and then what's causing COVID-19, which is SARS-CoV-2. That's the name of the virus. So there are seasonal human coronaviruses, and coronaviruses generally are a much larger family of viruses that can infect many, many different species, including birds, and bats, and many, many other species. And so we think that antibodies to previous coronaviruses might be, and others also think that they might be implicated in disease severity. So that's something we're trying to work on now. And again, it's just in the early phases of writing the protocols for starting to collect the samples. And of course, we would need patients, and those are just slowly, and thankfully slowly, being admitted to the Soroka Medical Center, at least now. And then the other study we are trying with a collaborator from the Open University, who's a computer scientist and a good friend of mine. We're trying to put forward an idea to do rapid high throughput testing of asymptomatic carriers. So another big problem with COVID-19, with this disease, is that many of the people who are infected with this virus are asymptomatic, and they are circulating and walking around. They don't have any clinical symptoms, and yet there is data to show that they can still infect others and spread the disease. So these people are suffering from very, very mild disease. They're not at any risk of death or complications, but they might infect or spread the disease to others, which then might have complications.
So this actually, I took a peek at one of our questions, and it came from what can I do if I'm asymptomatic? I feel healthy, but I have an elderly parent or somebody who has an underlying condition that's part of my loved one.
Yeah.
Or family. What
So
can
those people need to be extra careful, I guess, because if they want to be able to interact with their parents or family members that are older, they need to make sure that they are at least reduce their chance of getting infected as much as possible, honestly. So we're trying to develop a way by which we can efficiently test asymptomatic subjects, and we want to start with hospital staff, which are at great risk of getting infected because they're treating patients, but also because preventing spread in the hospital would be key to handling and taking care of all the individuals that are hospitalized for COVID-19. So we are now in early discussions with the Ministry of Health to try to get some funding and collaboration from the Central Laboratory to basically try to see if this approach can be implemented and then rolled out to actually test people within Israel. So those are the two things we're actually actively trying to work on at this point that are related to this specific outbreak.
Okay, thank you. Let's switch to you, Ron, real quickly. Ron Taub's joining us, Dr. Ron Taub. He has his BS and PhD from Tel Aviv University, and you completed your postdoc work at some institutions in the States on the coast. One, you studied pathogenesis at the University of California at San Francisco, as well as spent some time working at the Harvard Medical School. I think we've heard of that institution. And you've been part of BGU's Shraga Siegel Department of Microbiology, Immunology, and Genetics since 2008. Right now, you're part of a team that has a lab that is at biological safety level 3, from what I understand. So can you explain what you do, what you're trying to do in your work, and what even biological safety level 3 means?
Okay, so thanks for having me. Well, part of the national restrictions and things that are being done on a national scale, we are in Israel and in BGU specifically, we're trying to somehow find a way to treat or tackle the virus both on a humoral aspect and molecular aspect. And we are in BGU came up with a team that is trying to tackle the virus in these two aspects, meaning utilizing or characterizing the antibody response of patients that are infected with the virus. And this is one part of this consortium that have been established here at BGU. And the other way to tackle this problem is to find out a way to treat the virus with developing a vaccine or coming up with a passive immunization in the form of antibodies that will be developed in a molecular way of approach. So this team is a large team here at BGU. It includes MDs, Tomer is part of this team, and people, MD and people from Soroka Medical Hospital that basically brings all the corona infected patients in the south of Israel. So it's a large project. And these people are coming together to establish a way to, as I said, to tackle the virus. So our lab is trying to do it in a molecular way, and I'll try to simplify the approach. It's basically to use somehow a very high throughput screening assay to identify antibodies that that are called neutralizing antibodies, meaning these antibodies can inhibit the entry of the virus into target cells in human beings. So we have a kind of very large libraries that we are developing and characterizing, and coming up with a platform that will screen these libraries in order to find antibodies that can basically inhibit the entry of the coronavirus into cells. And obviously these antibodies can be developed also to fully humanized antibodies that can also mediate cytotoxicity effect and recruit the cellular system in order to tackle infected cells. So this is kind of a large group that each one of us contributes in order to bring up and come up with a solution against the virus.
When you're dealing with a disease or a virus that is so contagious, how do you, and in the lab, how do you keep yourself safe? And
so in the lab itself, it's a research lab, so we don't have a P3 safety lab, and we are trying to develop models that will be very close to the actual infection that occurs in human. Obviously, there is in a Soroka Medical Hospital a lab that is a P3 level safety lab, which has all these measurements in order to safely use and treat cells or samples that are coming from infected patients. So it's a different level that we don't have it in our research lab, but we have access to this highly safety P3 facility.
okay, great. So I want to try to move to some questions. I'm getting, this is like a multitasking digital 21st century environment with a broadcast media at the same time. It's amazing. Nadav has been participating already with members in the Q&A function, so, or in the chat function. If you go into chat, if you're one of the 229 people participating, you can click on the chat, ask some questions. Our panelists will be able to respond to those while we're talking about maybe something related or something different. So feel free to use the chat function. I'm going to switch into the Q&A where we have a whole queue of questions that have popped up, and I'll do my best to try to direct those to the specific panelists. And if you want to ask additional questions in the Q&A, just click on it and maybe note the panelist you're trying to address the question to, and I'll make sure that we get there to the degree possible. We're at 12:33 Eastern Standard Time, so we have almost a half an hour for dialogue with the audience. So I'm switching to the Q&A. And we have a question. We've covered this a little bit, but it's a very straightforward question with a difficult answer. Are you actively working on a vaccine, and are you aware there have been announcements of other breakthroughs in Israel as it relates to a vaccine? So I think this is mostly for Ron and Tomer.
Tomer, go ahead. So I'll just say that there are several initiatives in Israel trying to develop a vaccine. There is one in Migal that are reportedly very advanced in terms of trying to develop a recombinant protein that will be able to be used for developing a vaccine. My lab is trying to tackle the virus not in terms of developing a vaccine, which probably will take, if you think about it, at least, if you think back, it will be at least 12 to 18 months available. So we're trying to try something more fast, which is developing passive immunization by trying to develop or identify antibodies that will be able to treat and tackle the virus.
Yeah,
Thank you.
And I would just say that, really, the vaccine is probably our best hope, but it's likely we will have a vaccine, as Ron said, only within 12 to 18 months. So it's far out.
Not what we wanted to hear, but thank you. Okay, so we are getting a question about, I think this relates mostly, Limor, to you for emergency preparedness, or Nadav. It's asking about the Israeli government's role in making sure that citizens that may have underlying conditions or are over the age of 60 don't have to go out to get the food. Are you aware of any actions by the government, maybe, that our government could follow as a best practice in terms of how to keep the most vulnerable people safe?
There are now already several initiatives now the municipalities and the welfare system is actually fulfilling the role. There are also lots of volunteers, but we have such contingencies in order to get to the elderly. This was mainly during wars, etc. I'm not saying it was perfect, but there are definitely plans for that. Limor, if you want to add.
Especially I'll talk about Beersheba because this is where we've been operating, but I think this model can operate in other places as well. The municipality has arranged a group of volunteers or volunteering organizations, a lot of NGOs that are ready to go out and help in whatever is necessary. BGU volunteering system started a few years ago when missiles were falling. There was an academic study that led by a group from the Prepared Center for Emergency Response Research, focusing on the elderly and people with illness in the community and connecting, actually putting them on a GIS system, on a geographical information system. So the welfare system of the municipality knows where these people are and we know to access them. And it's also that the municipality knows a lot about the population so it can split them. The problem right now with the volunteering is that the Ministry of Health issued some regulations about who can volunteer and who can't volunteer. For example, just yesterday, they decided that the high school students are not allowed to volunteer in this epidemic. So the number of volunteers are narrower than they were originally, but the system is there, and I think that the community is actually reaching out. And also, another thing that's been done is very clear messaging about the older people, and not very old. It's above 60 that have to stay away from close social contact, and the community around them are just gathering to help.
Okay, we have a good question coming in from one of our board members, Marcy Dollinger. She asks, do we have any idea how long the contagious period is for COVID-19?
Wow, this is the 1 million or billion or trillion dollar question. There are now several models. You can also see them now. They were kind of almost top secret. Now they're open to the public in the next few days. Let's say that for sure it will be with us at least for several weeks and months. The question, what will happen during the summer and what will happen after, because if you're flattening the curve, one of the consequences that it takes much more time. And the question also of reaching to what is called herd immunity. So we need now to wait at least the last 2-3 weeks in order to understand where it is going, because we are just in the beginning of the rise and local transmission, and the pace of it would be very, very important, and how efficient are the measures that the Minister of Health announced.
Some of the media has reported here about this virus being sensitive to heat, and that when it gets warmer, it might make the virus go away. Do you have any comment on that?
There's been one study suggesting that there is sensitivity to temperature, but it hasn't been reviewed yet, to the best of my knowledge. And so far, I haven't seen another study, so it's too early to tell. Needless to say, if it does, as Nadav said, if it might go away in the summer or early summer, it'll definitely be back in the fall. So, I mean, it's not going to just go away in the summer and disappear. It's likely to hang around at low, volume during the summer months if it does wane, and then it will pick up again as fall, hits again.
So I just want to add that. I just want to
Go ahead,
add
Ron.
something that we need to know that this virus is an envelope virus. It means it has kind of a lipid around it, making it quite sensitive to detergent and pH levels. So restrictions or orders like keeping your hygiene and cleaning your hands and keep distance is very important, knowing the family of this kind of RNA viruses.
That's excellent. That includes, because we've heard wash your hands for 20 seconds and keep the distancing, but are you saying people should be doing laundry more often?
I didn't say that. I just said that keeping high levels of hygiene is important and can be very efficient.
Basically, there are studies suggesting that the virus can persist on surfaces for extended periods of time. So like on plastic, for example, or metal, it can persist for up to 3 days, infectious particles. So that basically means that, door handles, knobs should be disinfected. And basically, if you can open the door without using your fingers, you should try to do that. That's probably also going to be helpful. But there's no way around it. One way or another, many of us are likely to contract this virus at some point.
Limor, you were just sharing some excellent information that was coming up in the chat. So why don't you share with the group in terms of the question is, the media is all over the place and some of it is trustworthy and some of it isn't. What are the good sources of information to stay up to date on fact versus fiction? Limor?
Well, for Israelis, definitely the Ministry of Health website is keeping itself very updated and in various languages. It's available in Hebrew, in English, in Russian, Arabic. Most updated in Hebrew, but still the other languages are updated as well. It also contains information about the routes of people who were identified as infected. So in order to get broader circles of people in isolation, as of tomorrow, it may be less important because all of us are going to be in some sort of isolation, but it is important to know the path of the people who are infected by the virus, because then anybody that was in those places at that time goes into isolation and prevents the continuance of the spread. Other than that, the CDC, the Centers for Disease Control in the US, has a website that's very informative. It has different web pages for different populations. So it can, if you're a healthcare provider or if you're whatever, a teacher, or different populations have different information for them. Very informative. The WHO, World Health Organization, also has information. And it depends on the level of and the kind of information you like. Most medical journals try to have updated information. Some of them are not at the deepest scientific normal descriptions, so people can, even lay people may be able to read these journals and get a picture of what's going on.
I'm getting a question from a Charles that's a little bit targeted at you, Nadav, which is that we've talked about self-quarantine. The question is really how long, should people be quarantining? And if the virus shows up and you get sick 2 to 7 days or 14 days from initially being exposed, what if you're asymptomatic, but you might be a carrier? Should you be quarantining? What does that look like and how long might this last? if Israel goes into a quarantine policy?
We need to understand that the current regulations are not for so much for the individual patient, but just in general, in order to reduce as much as we can the social interactions. And it was quite clear that after the quite dramatic announcement on Motzei Shabbat, on Saturday evening, in the last few days, many Israelis actually felt that it's more like a holiday and they were going to the beach and to the parks. So knowing the internal discussion, this was also part of the idea, reduce social interactions. We need to scale up our testing system in order to understand what is going really in the community, because until now, most of the testing was done with people returning from other countries or those who were exposed to people returning from other countries. So only in the next few days, we will know exactly what is happening in the community and how the new measurements are going to influence. And I think in 2 weeks, we'll have a much better idea where is it going there or is it going there. I know it's very frustrating to be, in such a certain of uncertainty, but that's the situation right now.
I'm getting a question asking, is it okay? Is it safe to go outside and participate in non-contact activities, or do people really need to be just staying indoors?
And this is a very important question because even in the current Ministry of Health instructions, going out and doing some, running or workout, that's something that is actually advised. So you cannot just sit 3 weeks at home, not like doing nothing. Of course, some of us can do some certain things, and there are some funny clips on YouTube how to do it with toilet papers, etc. But
you have to be able to find toilet paper first. I'm not sure if that's a challenge in Israel, but in the States, we can't find toilet paper. But I've seen those videos. Keep going, Nadav.
No, so I'm just saying that the whole question of health promotion and how to keep doing physical activity is very important. And if you're keeping the social distancing and, going maybe once a day to do some activity outside and not with social distancing, so that's something that is part of the instructions. So it's not like a total quarantine.
Right, and also I would point out that there's a lot of data now suggesting that physical activity does boost your immune system. So generally keeping fit, and since this is not going to be 1 or 2 days at home, is probably going to contribute to your overall health and possibly protection from this virus.
And mental health also.
So that's very important. Thank you. So you're actually encouraging people to stay healthy, be fit, because that will help with their immune system and ability to fight off things as they come. And just sitting at home watching TV panicking at your couch is not going to be good for anyone. Is that correct?
Yes.
Okay. Very good. I have another question coming in for you, Limor, I think, and you addressed this a little bit. Did BGU close dorms like Harvard and Stanford and other universities? And if so, where did the students go?
No, we did not close the dorms. We were kind of surprised when we saw other places do it, but we didn't think it was the right thing to do. We try to continue providing the most supportive environment for our students. We maintain it safe. When we did have a group of students arriving from Germany and having to be quarantined, we made sure that we can give them the quarantine, the isolation that they needed. We had delivery of food for them, and we would put things by their door and so on, and we made sure they keep their isolation, but we didn't throw anybody out of the dorms. For Israelis, we do prefer that they go back home if they can, because we don't have room for so many people in isolation. So we try to ask the Israelis to go back to their families. But not everybody feels comfortable to go back home, and we didn't throw anybody out of the dorms, and we never closed the dorms.
Thank you. I have a question coming in around if you do get infected, let's say you're asymptomatic and then you are back to normal, are you now immune from the virus, or can it come back and mutate and reinfect you?
That's another $1 million question, I guess, to which the answer is not completely known. Definitely you have antibodies, and there are actually serological tests being rolled out for recent infections, so we know that they exist. The major question is how long do these antibodies last? And that is based on what we know, they might last anywhere from a few months to several years, and that might also change by subject. So different people will have different antibody repertoires for this virus. But certainly I would say that for the first outbreak, pandemic we're seeing now, if you get it, it's highly likely you will not be able to get it again with any time in the near future.
I'm getting a question from one of our Zinn Fellows, which is a young leadership program we have for the next generation of our leaders here in the States. Adam Titkin, who lives in Miami, is asking, first he thanks the panelists for what you're doing. He's asking really about the media, and if you're watching the media, how reliable is the information that we're being fed? Do you think it's mostly reliable, or, you know, as a layperson watching, what do you do?
Well, I mean, it depends on where you get your information, right? I mean, there are lots of information sources, and some of them are really, you know, very disturbing. I mean, there are definitely all sorts of rumors going around that are completely fake news. And one needs to choose credible sources from which to get information. So I think Limor pointed out to some good websites, you know, definitely things posted by agencies like the CDC or the WHO or, you know, Johns Hopkins or, you know, the Ministry of Health in Israel are very reliable. You know, around social media, there are many, many stories being told, some of which are just, you know, mind-boggling, but still carry an audience and are being spread, right? None of which I think have any, you know, real evidence to back them up.
Thank you. I'm getting some questions about the next school semester. People wondering if medical school's supposed to open in August. Do you anticipate that happening the next fall semester, or do you see remote learning for some time?
It's kind of early to answer that question because we're still dealing with the current semester. I'm very happy that we're able to continue with this semester as planned, so no student has to delay the graduation or change the plans. Again, depends if you're looking at how much travel is involved and how limited the travel will be at the time. Because campuses are closing across the US and people are discharged and people won't be able to take some of them their exams maybe. So it's kind of early to say. Hopefully by May or June, we're much smarter and are able to predict that.
So I just want to thank you. I want to thank all the panelists, and I want to thank all the participants because now up to 43 questions. I've been trying to get through them and ask, but really appreciate the interest in terms of our participants. We're up to close to 240. Let's take the last couple of minutes to just let each of you give some closing comments. If there's something you had meant to share but hadn't, please do it now. And why don't we start with Nadav?
So this is not Armageddon. We're going to survive. The question is how we going to leverage this really very challenging situation. I think that this can bring solidarity. It can bring innovations like Tom and Ran were presenting before. But it can also bring, unfortunately, cases of racism and you know, trying to keep yourself and be very panicking, anxious. And I think we need to see, especially it's about leadership, how leadership not just about the government, it's also about the small communities and the family. And I think we can turn it into something that is remarkable. And I'm sure that here at Ben-Gurion University, with the spirit and atmosphere, that's what we're trying to do right now. And broadly in Israel, of course.
Thank you. Limor?
In general, I think that solidarity is something that's very important. I totally agree with Nadav here. A lot of our studies have been focusing, as Nadav said earlier too, about community resilience. And I think that the community resilience relies on several things like the leadership, like the preparedness, and the social cohesiveness. And I think it's important that we realize that everybody's role is not to look only at the health of himself or herself, but also to look at the people around him and the community around him at a time like this. In terms of BGU, hopefully we will be able to continue handling this the way we have handled it up until now. And I think that once we're over this crisis, we're going to be much stronger and better than we were entering it. And hopefully everybody stays healthy and we can go back to our routine quickly.
Tomer?
So I think, we are just starting to understand the broad impacts of this pandemic. And I think, they are far beyond just the number of people infected and, mortality. There are many, many different aspects that are going to change our lives in many ways, which I think most of us still don't even understand. I think we need a lot of patience, and we need a lot of flexibility to understand that what may be true today might change, within a week. And guidelines, recommendations, understanding of what needs to be done is, shifting constantly as we learn more about the virus, as we learn more about how to treat, patients, and as we learn from experiences of countries that are now, with heavy disease burden. So I would just urge everybody to keep an open mind and to understand that this is not, something in our playbook. We don't really have predefined. We haven't seen anything like this in the last, I would say, 100 years. So definitely something that we have to learn how to deal with.
Thank you. Ron, last word for you, and then I'll just make some closing comments.
Yes, so like the other panelists, I'm an optimistic. So I think we're on the urge to somehow overcome this crisis. And it's also a kind of a waking call for funding agencies and people that aim to fund the research, because viruses have been here since ancient history and will be here. And this is what viruses do. Most of them we can overcome, but some of them once in 100 years come around and do what they're doing. And we need to be ready because it's not the last epidemic that we'll encounter.
Thank you. So I just want to take this moment to thank all the participants for joining us for this webinar, live from Israel, Ben-Gurion briefing on the coronavirus. I want to thank our panelists, Professor Limor Aharonson-Daniel and Professor Nadav Davidovitch, and Doctors Tomer Hertz and Ron Taub. Ben-Gurion, David Ben-Gurion, the founder and first prime minister of Israel, and also the guy whose name is on the door of our university, once said that in Israel, in order to be a realist, you have to believe in miracles. And I think this is one of those times where we can believe in miracles. And the miracle is the Jewish state and what it's doing. And I think by just the work of the panelists, you can see that there's a promise for the future. In a few short weeks, we'll celebrate Passover. If you remember back then, it took 10 plagues before the Egyptians realized it was smart to free the Jews from slavery. And in this case, in the year 2020, perhaps it's just one pandemic that will wake up the world and help us heal and get across the divisiveness and the politics that separate us and bring us together as humankind. If you're interested in helping We have put together a fundraising effort to support the relief work at Ben-Gurion University. You just go to www.aabgu.org/donate/COVID-19, and we will do our best to continue to support the great work of Limor, Tomer, Ron, Nadav, and others. And if there's interest, feel free to text me, message, etc., and we'd be happy to continue with additional series in this webinar series so that you can get a little bit more inside look at the remarkable science happening at Ben-Gurion University. Thank you all so much and have a safe, good day.
Thank you.
Thank
Okay.
you. Healthy.
All right. Stay healthy. Bye.
Bye. Thanks, everyone.